ISUOG Journal Club, January 2013. Improving Strategies for Diagnosing Ovarian Cancer, a summary of the International Ovarian Tumor Analysis, IOTA, studies. J. Kaiser, T. Born, L. Valentin, I. Suzanne, C. Van Holsbeck, I. Vergoot. A. Testa, D. Franchi, B. Van Kalster, D. Timmerman. Volume 41, Issue 1, date, January 2013, pages 9 to 20. Journal Club slides prepared by Ligita Jokudgin. ISUOG editor for trainees, correct discrimination between benign and malignant ovarian masses. Previous studies limited by small sample size, single center population, different tumor types, not standardized ultrasound terms and definitions, lack of consistency in histological reports. Aims of the IOTA studies. Improving Strategies for Diagnosing Ovarian Cancer, a summary of the International Ovarian Tumor Analysis, IOTA, studies. Kaiser et al., ISUOG 2013. Aims of the IOTA studies. To develop rules and models to characterize ovarian pathology. To test the diagnostic performance of rules and models by external validation with examiners of different levels of ultrasound experience. To establish the role of CA125 and other serum tumor markers for the diagnosis of ovarian cancer. To identify the characteristics of ovarian tumors that are difficult to classify as benign or malignant. To validate these models or rules in non-operated patients by studying the outcome of adnexal masses classified as benign. IOTA Phase 1 Training Set Test Set. 1,066 non-pregnant women. At least one persistent adnexal mass. 9 clinical centers in 5 countries. Training set. 754, 71%, patients. Test set. 312, 29%, patients. 2 logistic regressions models developed. LR1 and LR2. Timmerman et al., J. Col, 2005. Variables used in logistic regression models. Personal history of ovarian cancer. Current hormonal therapy. Age of the patient. Maximum diameter of the lesion. Pain during examination. Ascites. Blood flow within a solid papillary projection. Purely solid tumor. Maximum diameter of the solid component. Irregular internal cyst wall. Acoustic shadows. Color score. LR1. 12 variables. LR2. 6 variables. Timmerman et al., J. Col, 2005. Prospective validation of the models. IOTA Phase 1b. 507 consecutive women. 3 centers. Prospective validation of the models. IOTA Phase 2. 997 patients in 12 new centers and 941 patients in 7 centers from Phase 1. External validation of the models. J. Van Holsbeck et al., Cancer Res, 2009 and 2012, Timmerman et al., ISUOG 2010. Simple ultrasound-based rules. Based on subjective assessment of ultrasound images. Rules could be applied to 77% of ovarian tumors. Classify tumors as benign, malignant or inconclusive. Included IntraCog guideline for evaluating ovarian pathology in premenopausal women. Timmerman et al., ISUOG, 2008. Features of a benign mass, B features. A mass is classified as benign if at least one B feature is present and no M features are present. Features of a malignancy, M features. A mass is classified as malignant if at least one M feature is present and no B features are present. Simple ultrasound-based rules. If the rules are inconclusive if no BM features are present or both B and M features are present. Rely on subjective assessment by an expert ultrasound examiner as a second stage test. Diagnostic performance of the models and rules. External validation. Raychalk sensitivity specificity LR plus LR. Similar diagnostic performance between LR1 and LR2. LR1. Cutoff 10%. 0.9692%, 87%, 6.80.09. LR2. Cutoff 10%. 0.9592%, 86%, 6.40.10. Simples rules. NA 90%, 93%, 12.60.11. RMI. 0.91, 67%, 95%, 12.70.34. Simple rules supplemented with subjective assessment of ultrasound findings when the rules could not be applied. IOTA Phase 2. Diagnostic performance of the models and rules. LR1, LR2 and simple rules had similar diagnostic performance in IOTA Phase 1b and Phase 2 datasets. Timmerman et al., BMJ, 2010. Descriptors of an ovarian mass used to make a diagnosis. BD, benign descriptor, MD, malignant descriptor. The role of CA125 in diagnosing ovarian cancer according to IOTA results. CA125 has no significant impact on performance of logistic regression model for women at any age. Adding information on serum CA125 level to subjective assessment of ultrasound findings does not improve diagnostic performance of experienced ultrasound examiner. Timmerman et al., J. Conan Call, 2007, Van Calster et al., J. National Cancer Inst., 2007. Valentin et al., ISUOG, 2009. Diagnostic performance of the models and simple rules to detect stage 1 ovarian cancer. LR1 and LR2 had higher detection rate of stage 1 primary ovarian cancer than RMI. Simple rules combined with subjective assessment when rules did not apply misclassified fewer stage 1 ovarian cancer than RMI and CA125. Javan Holzbeck et al., Clin Cancer Res, 2012, Timmerman et al., BMJ, 2010, Summary of the IOTA Project. Improving Strategies for Diagnosing Ovarian Cancer, a summary of the International Ovarian Tumor Analysis, IOTA, studies. Kaiser et al., ISUOG 2013. Summary of the IOTA Project. Pattern recognition of ultrasound features of an ovarian mass by an experienced examiner is the best way to characterize ovarian pathology. A small proportion of solid tissue makes a malignant mass more likely to be a borderline tumor or a stage 1 primary invasive epithelial ovarian cancer. CA125 does not improve diagnostic performance of assessment by experienced ultrasonographers. Two main approaches to classify ovarian masses have been developed. Risk prediction models, LR1 and LR2. Simple rules or easy descriptors. Multi-class models have been created to distinguish between benign, borderline, primary invasive and metastatic disease. Recommendations for clinical practice. Improving Strategies for Diagnosing Ovarian Cancer, a summary of the International Ovarian Tumor Analysis, IOTA, studies. Kaiser et al., ISUOG 2013. Recommendations for clinical practice. 1. IOTA simple rules can be used as a triage test in 75% of all adnexal masses for estimating the risk of malignancy. 2. A two-step strategy with referral to a specialist in gynecological ultrasound of unclassifiable masses rules has excellent diagnostic performance. 3. An alternative to the simple rules is the LR2 model. 4. LR2 or the simple rules should be adopted as the principal test to characterize masses as benign and malignant in premenopausal women. 5. Measurement of serum CA125 marker is not necessary for characterization of ovarian pathology in premenopausal women and is unlikely to improve the performance of experienced ultrasound examiners even in postmenopausal women. Different approaches to estimate risk of malignancy. Improving Strategies for Diagnosing Ovarian Cancer, a summary of the International Ovarian Tumor Analysis, IOTA, studies. Kaiser et al., ISUOG 2013. Different approaches to estimate risk of malignancy.